Hello, distinguished ladies and gentlemen. You're welcome to day 2 of the IOSH West African Conference 2021. I am Temi Popola, your conference host for yesterday and today. Now, yesterday was a fantastic day. We have over 800 users on this event platform. 213 connections were made. Almost 300 people listened to some fascinating presentations and took part in discussions. 435 total discussions were created in just one day. Everyone is connecting and making good use of SwapCard. Today, we look forward to welcoming many more participants. Now, before we begin the first session for today, I'd like to remind you all to engage through the chat box and to rate every session you attend when you're prompted by SwapCard. Now, I love the energy that you brought yesterday. As you drop chat, you welcome speakers so warmly, and I trust that you'll bring in much more fun today. Please drop your favorite emojis as we welcome speakers. Now, when any speaker says something that resonates with you, don't forget to give them a round of applause in the chat room. Don't forget also that we have a photo booth and would love to see your photos on the gallery wall. I took a look at the gallery wall and I saw really lovely pictures. I also found some on LinkedIn, so please keep them coming. And don't forget to use the hashtag IOSHWAC21. Again, the hashtag to use is IOSHWAC21. Now to the competition. You recall that there was a competition yesterday and there's another one today. A competition to win a free space on IOSH Level 3 safety course continues today. To stand a chance to win a free space, ensure that you keep looking through all the sessions for the polls and answer the questions correctly. So when you find the polls, be sure to answer the questions correctly. We'll announce the winners later today in the session that focused on taking a proactive approach to IOSH in West Africa. So be sure to attend that session to find out if you have won. I mean, even if you're not taking part in the competition, I would say that you should attend that session because it promises to be impactful. Now, today is packed full of interesting and exciting sessions. We'll hear from Dr. Ivan Ivanov from the World Health Organization. And then following this, we have another session that looks at safety in educational institutions. And running alongside that is a session that discusses the passage of the IOSH bill in Ghana. Later on, there'll be an exciting session discussing women in IOSH. And I must say that I'm looking forward to that. Our closing session sets out a vision of the future of IOSH in West Africa. Now let's get our day off to a great start with a panel discussion that addresses how we care for those who are working in the healthcare sector. If we have learned one thing over the last year, it has been how critical healthcare workers have been in the fight against COVID-19 pandemic. And you would agree with me, distinguished ladies and gentlemen, that if we neglect their health and well-being, we do so at our own peril. And that's why I'm very honored to make welcome Dr. Ivanov, the head of occupational workplace health at the World Health Organization. He has been working closely with IOSH over the last couple of years, and he will now open this panel discussion. So with a resounding applause in the chat room, please make welcome Dr. Ivanov.
Thank you. Thank you very much, Tammy. And once again, big thanks to IOSH for the collaboration over the last year and a half, more than already year and a half over COVID. We had a really wonderful collaboration to spread the word around the world about protecting health and safety at the workplace during COVID time. And now we want to focus on health workers and how to build a healthier future for those who care for us. And today I'm pleased to have with me a number of panelists and speakers who will cover the different aspects. We'll hear from my colleague from the WHO Regional Office for Africa, Cynthia Davis, about the WHO initiatives and campaigns on health and safety of health workers. Then we'll have a round discussion with experts from countries in West Africa which have developed national programs on occupational health and safety for health workers, from Lovelas Digbear, from the Ghana Health Service, Dr. Lovelas Digbear, Dr. Silver Kevi from the Ministry of Health of Togo, Dr. Buba Manjang from the Ministry of Health of the Gambia. And then we'll have also a feedback, reflections from the representatives of health workers themselves, how they think about the programs, from Mr. Baba Aye from Public Service International, the trade union of workers in public services, including health workers. So without any delay, I would like first to ask Cynthia to tell us about the WHO call for action and initiatives.
So much. So as we can see, will you kindly share the slide? Okay, so let me just share with you a few points from WHO call for action. So dear colleagues, the COVID-19 pandemic has demonstrated that the health system and health facilities have failed to protect the health and safety of health workers. Next slide, please. Hundreds of thousands of health workers lost their lives to COVID-19. Others had damage to their mental health and experienced violence. For this reason, the World Health Organization and the International Labour Organization have called upon countries to scale up the protection of health workers by developing specific programs for occupational health and safety at the national and facility levels in the health sectors. Next slide, please. All countries and all health facilities should have programs for occupational health and safety of health workers. Such programs include responsible pricing of better units for occupational health and safety of health workers, health and safety committees at national and facilities level, policies and standard operating procedures, regular risk assessments, including finding and fixing the hazards, responsible incident, reporting incidents such as blood exposures, violence, etc. Health surveillance of health workers and occupational health and safety, including surveillance for health services and services for HIV, tuberculosis, and mental health. Also considering immunization and other actions. The WHO and ILO will issue, by the end of this year, a guide on how to develop and implement such programs at the national, subnational, and facilities level. Next slide, please. The health and safety of health workers is closely related to quality of care and patient safety. The principle of healthcare is first, do no harm. Healthcare should be safe for patients and for workers. Occupational burnout is a major cause of medical errors in delivering healthcare. Many health workers experience violence and harassment from patients and their relatives. The World Patient Safety Day last year focused on health worker safety. The WHO issued a charter on health worker safety, and you are all welcome to sign to it as an individual or organization. There are also many campaigns material on the WHO website that you can use to raise awareness about health worker safety. Next slide, please. This year has been designated by the World Health Assembly as the International Year for Health and Care Workers, under the theme, Protect, Invest Together. Occupational health and safety cut across these three themes. The goals of these campaigns are to ensure the World Health and Care Workers are prioritized for the COVID-19 vaccines, to commit countries, donors, and partners to protect and invest in health and care workers, to also engage countries and stakeholders on a care compact to protect health and care workers' rights and decent work and practice environment. The WHO Regional Office for Africa is committed to work with countries and partners to develop and implement decent programs for occupational health and safety in countries. As you will hear from the panelists from Ghana, the Gambia, and Togo, this is possible. Other African countries have also developed such programs. These are Kenya, South Africa, Tanzania, and Uganda. For more information, you can check out the WHO website for health topic, occupational health and safety. I thank you. Over to you, Alan.
Thank you very much, Cynthia. Exciting news from WHO. Thanks for sharing. And I would like now to turn to our colleagues from the countries who have developed and who are implementing such programs to tell us about how they have developed these programs, how the programs were developed, how the programs were launched. We can start with Ghana, Dr. Lovelas.
Thank you, Dr. Ivanov. Ghana, we started programs some years back when we realized that health workers were having some challenges. And the first thing we did was to set up a unit at the Ministry of Health. Then we realized that to have an effective implementation of the program, we need a policy because at that time, and even now, Ghana, we don't have national health and safety policy for occupational health. So we needed a policy to guide us in the implementation. So the policy was developed, occupational health and safety policy for health workers was developed in 2010 and launched. Then we went to the next step of having focal persons in the regions because even though we had a unit at the headquarters or at the Ministry of Health, it would have been difficult. I mean, going to all the regions to implement and monitor. So there was a need to have focal persons in all the regions. So focal persons were selected and were trained on the policy and other important areas in occupational health and safety. So to date, we just have focal persons, but we realize it's also a challenge because when we look at how the how implementation is currently, it's a big challenge. So when we get to the challenge section, I will talk about some of the challenges and the solutions that
about the challenges.
So basically, we have the units at the Ministry of Health, we have the policy, and we have focal persons.
Excellent. Thank you very much. Dr. Kevi, bonjour. How did you do it in Togo?
In Togo, beginning in 2016, after you have some infections of health workers during the Ebola epidemic. And then we have the opportunity to have the invitation of ILO and WHO to South Africa. And then you have training some persons, me and other colleagues. And then when we come back, we have make some training for 13 health facilities and for 40 members who was from Minister of Labor, Minister of Finance, and the representative of workers. And then for this training, you have make 13 pilot health-wise pilot facilities. And then at 2017, we have make some finalization drafts of the strategic plan of occupational safety and health for health workers. And then after we have made this plan, you have to share with the others with health workers, with the other minister. And then at the middle of the 2017, you have the strategic plan you have validated, and then you have the Minister of the Health who have to sign it, and you have to share it for all of the to share of all of the stakeholders in Togo. And then you have the section of occupational health where that I coordinate. And then in this session, we coordinate the implementation of this program in Togo. Thank you.
Excellent. Thank you very much. Very interesting. And we have also, we hear that in Gambia, there is already a program quite well developed. And we have Dr. Buba Manjang from the Ministry of Health of the Gambia. Dr. Buba, how the program in Gambia was developed? You can unmute yourself. Okay. Well, when he's back, we can ask him all the questions.
But
yeah.
yes.
You are with us. Unmute yourself. How the program was developed in Ghana for occupational health, in Gambia for occupational health workers?
Yes. Hello. Are you hearing me?
Yes, we do.
Yes. So I'm saying the occupational health and safety program was developed in 1993 by the Ministry of Health to take care of the health and safety of the healthcare workers, as well. We were able to develop programs and activities, and this was launched in collaboration with University of Maryland in the US. Then we developed the policy, healthcare policy for healthcare workers in 2016 in collaboration with partners, Professor Melisha and Professor Joanna in the US. And this policy is already developed, and then we were able to submit this to the Honorable Minister, and then from there we'll be able to enforce the activities in short.
Great, great. Thank you very much. My second question to the three of you is, what are the strategic priorities you set for your national programs? And we start with Togo. Dr. Kevi?
Yes, the three priorities that we have.
Okay.
The three priorities that, are you hearing me?
Yes, yes, continue.
The three priorities are: we want to reduce exposure to bloodborne pathogens among healthcare workers, and also we want to control airborne diseases as healthcare workers are exposed to, and also proper management of. So you can see we were working very hard to make sure that healthcare workers are protected. That is, the priority areas are reduce exposure to bloodborne pathogens, control of airborne hazards, as well as taking care of clinical waste in our health facilities. So these are the priority areas that we are looking at, even before the advent of the COVID-19.
Very interesting. Dr. Kivi, what are the priorities in Togo?
Yes, in Togo, you have 4 priorities for our strategic plan. The first is reinforcing institutional and juridical frame. And then you have to make protocol and directive of occupational safety and health for health workers, to have a committee in the regional, in the national and the facilities levels. And at the second, you have to promote occupational safety and health for health workers. And then you have to make communications tools, and you have to extension the pilots, the center pilots of HealthWise to the other facilities. The third priority is the building skill in actor by training, equipment, data, and collect. And then you have to have some health workers basic training program. And then you have here, you have 2 center of health, public health, where we have the HealthWise of program was in training. And then at the last priority is the reinforcing the coordination, research and monitoring and assessment of the program of occupational safety of health for health workers. And then you have to how to have to implement this in electronic, you have e-HealthWise, and also you have to follow the assessment and to how to improve the program for all. Thank you.
Very exciting, interesting. It's useful to hear how different approaches the countries have taken in setting their priorities. Dr. Lovelas, what are the priorities for your program in Ghana?
Yes, in Ghana, we are looking at 5 key priorities. The first is the establishment of regional occupational health and safety units. Then our focus will also be on reducing the effect on psychosocial work environment, and also reducing issues related to musculoskeletal problems, and reduce workplace exposure to biological agents, and this will include managing healthcare waste. Then finally, prevention of needle stick injuries. So these are the 5 key areas.
Very interesting. Thank you very much. And I'm sure you had some successes in the implementation of the program. The very fact that it was approved is a big success already. But while you are implementing the programs, what were the factors that you consider were critical for the continuation and the success of the program? Dr. Buba, what do you think would be the success factors in the Gambia?
Yes, thank you very much. The success factors for us is when we were able to have that very good collaboration with the University of Maryland team, that's Prof. Melissa and Prof. Joanna's team in Maryland. We were able to conduct walkthrough activities at 3 of the hospitals or health facilities in the Gambia, and using toolkits, checklists, and this gives us an insight as to what is prevailing as a form of baseline to tell us the level of exposure and usage of various indicators as to which one to target. In fact, that made us to be able to prioritize those 3 priority areas that I had mentioned earlier. We also reviewed the occupational health and safety policy for healthcare workers, and this was drafted. There was training, and then as well as written, we wrote a very good policy document for healthcare workers, even before the advent of the COVID-19. And this is a coincidence because while we produce this, and suddenly we have in 2019, we saw ourselves in this pandemic, and then where healthcare workers are all exposed in one way or the other. So these are some of the achievements that we were able to realize in brief, in summary.
Super. Thank you. Thank you very much. I know Ghana had for quite some years already experience in implementing its programs. Dr. Lovelas, what were the factors of success? Why the program is still exists and not closed, like in some countries?
Yeah, I would say two main factors. One is having the occupational health and safety policy for health workers. And that has been our guiding principle, even though as I said, we've had a number of challenges and we are still managing these challenges. Then also we have a unit with dedicated staff, even though the workload is quite high, because we are yet to set up the regional unit. As I said earlier, we have focal persons in all the regions, but it's been a challenge because these focal persons are also focused on other core duties. So our key factors is, the two key factors are the policy and the unit we currently have.
Yeah, very, very useful lessons learned from Ghana. And Dr. Kivi, I know since 2017 you have the National Plan of Action on the Health and Safety of Health Workers in a lot of things. What do you think helped you to succeed with the implementation of this plan of action? What were the factors of success?
Okay, thank you. I can say that the first factor of a success is for us to have a unit in the Ministry of Health who coordinates all the occupational safety and health program and can collaborate with the Department of Labor. Well, that's the first. The second is the strategic plan of occupational safety and health for health workers that we have in 2017 with the support of the ILO. And I can say the third is the support of the ILO and WHO and the WHO, because as we have all of this support, we have also the political support. And then I think that you have the units at the Ministry of Health. Second, you have the strategic plan of occupational safety and health for health workers. And then you have the support of ILO and WHO and the political engagement. That I say that is the success factors of the implementation of occupational safety and health in Togo. Thank you.
Merci. Also, very, very useful lessons learned from Togo. And there is no program that has no difficulties and that has no challenges of being implemented. And if there are no challenges, it will be boring, of course. But frankly, in your opinion, in your experience, what were the challenges that you faced during the implementation of the program? And Sylvain, what were the main challenges that you faced in Togo?
Okay, thank you. The main challenge or the barrier for the implementation is the lack of financing of the project. That is the one of the main. And but the second is that we haven't enough specialists in occupational safety and health in Togo. We have just all of the specialists is in the capital, in Lomé, and then you have done many person in the other parts of the country. But we have do our best You have to do our best to change, because during our training of the health students, you have to introduce open safety and health in the program. And then you have a group of WhatsApp of all pilots, pilot health facilities, and then you have this group of WhatsApp for 50 years also. And then with this, we share all of our information, and then actually, you have the opportunity that health-wise is in the program who was in the response of COVID-19 in our ministry. I think that we have some barrier, but you have some successful possibility by this to improve this occupational health in Togo. Thank you.
Merci, Silver. Yes, thank you for being frank and open. And it is only by recognizing the gaps and the challenges that we can overcome them. If we just hide them, we will not be able to address them. And Dr. Lovelas, what were the challenges that you were facing?
Yes,
Ghana?
Thank you. Thank you. I would say that in Ghana, we have two main challenges. The first is not having adequate staff at the regional and the district level. As I said earlier, we have the staff at the headquarters, and we relied on the focal persons, but it wasn't working for us. So it's one big challenge. So we are looking at setting up the regional units and having dedicated staff who focus on just operational health and safety. It's a challenge also because the focal persons we have, as I said earlier, they have their core duties. They have other duties they are performing. They are doctors, nurses, etc. So what we want to do is to have operational health and safety units with dedicated staff in the regions and districts. And I think with that, the implementation will be successful. Then secondly, inadequate funding. Funding has always been the issue. And to support the implementation of this program, also we are working around to see how best we can get support for this program. Thank you.
Thank you very much. Also interesting lessons learned from Ghana. And what are the challenges for implementation of programs for health and safety of health workers in the Gambia? Dr. Manjang, Dr. Buba.
Yes, thank you so much, Evan. In the Gambia, we have, as I mentioned earlier, we have the policy in place. So implementation of this policy, because number one, we want to evaluate the prevalence of hepatitis B surface antibody, and also among health workers, and also conduct TB skin test surveillance in the workforce. So definitely this needs a commitment from the politicians, as well as it also needs the human resource capacity in place. So and also, of course, this cannot go without funding. We definitely need. We appreciate fully the collaboration we have with Boston, Maryland team, but we equally need more support to be able to implement these targets that we have. So our constant challenges that we are facing is how to implement these important activities, that is to evaluate prevalence of hepatitis B surface antibody, and equally to also conduct TB skin test surveillance among health workforce. Is very crucial. So these are some of the jobs, but we need funding, of course, for this. We need human capacity for this development. Thank you so much.
Interesting. Yes, the funding is common across programs, and certainly, but there are financial flows actually that target health workers. There is a global fund for HIV and TB. There are different other programs. So by bringing together the occupational health programs together with other programs that also target health workers, human resources for health, quality and safety of care, then it would be you would be probably able to use more efficient the available resources. But nothing can happen in a health facility in the world of work in the healthcare sector if the workers themselves are not cooperating, if they do not feel that they have been hurt enough, if they do not take the vaccine, if they do not follow the measures, and therefore they have a very important role. And I would like to ask my colleague Baba Aya from Public Services International, who is a big advocate for the rights and the health workers and the trade unions of health workers, also to tell us how he sees the role of health workers and their representatives and the organizations in the development and implementation of programs for occupational health and safety of health workers, national, subnational facility level. Baba.
Thank you very much, Ivan, and my greetings to all members of the panel as well. I'll start by commending the efforts in the different countries in the development and implementation of the national occupational health and safety programs, particularly for the health sector. However, I would say, and I mean, this also flows from what Ivan says of the central importance of health and care workers to the formulation and implementation of these programs. Talking with our affiliates across the different countries in the region, including Togo and Ghana. Unfortunately, Gambia is one of the few countries we don't have affiliates. We have affiliates in 160 countries, representing 30 million workers. Anyway, it's that they all appreciate the fact that the governments have put in quite significant efforts, and someone like Silvery used to be a member of our affiliates before now being in management, and so we appreciate the kind of spirit someone like that brings to bear. But they all say that there is still much more to be done, particularly in terms of involving health workers and the unions. And this leaves gaps, and it leaves severe gaps because, one, a lot has been said about the need for technical expertise, and which is quite legitimate. But you have health workers who could play roles at the facility level, who could also bring to bear their expertise, which could then be built on for OHS specific training. They won't be starting from zero in this regard. That is one. One of the things they also point out is the lack of the absence really of bipartite occupational health and safety committees. I mean, this should be a standard, but it is virtually absent in most of our health facilities across the region, where you have involvement of health workers at all. More often than not, it tends to be tokenist rather than bipartite. And I think that part of the problem also is because, you know, the overarching context is also that very few countries in the region have even ratified the ILO Convention 155 on occupational health and safety. You know, for example, I don't think either of the three countries here has ratified, and that itself is a problem, because the ILO conventions are multilateral international agreements which the countries have to, you know, report on, and which the different social partners, unions, even employers could bring, could point out where these have not been duly implemented. So in the absence of that, especially also where you don't have legislations, acts of parliament, it is difficult to make actionable even the best of occupational health programs. It doesn't have the power that it should, that it has the potential of having. So we would urge we would urge a conscious integration of workers and the unions in developing subsisting programs, because I also realize, I mean, some of these are in process of review, and also in implementing this, involving workers and the unions in the national programs, and promoting the involvement of workers and the unions in the healthcare facilities. And we know that with this, it will be to the benefit of the system of healthcare delivery as a whole.
Thank you.
Yeah, okay, I'll stop there. Thank you.
Yeah, I'm not cutting you, but there is already a question that is specifically directed to you.
Okay.
From Joshua Igle. I cannot read the name. Too powerful. That's great. But Dr. Babai, can you lend some comment on how power struggle for leadership among different professionals in Nigeria public health sector pose challenges to building safety teams in these public facilities?
Thank you very much for that. I was a union leader for like 2 decades in the Nigerian health sector union. So I understand what you say, but we should also put this in context. First, it had not always been like this. Part of how this came about was governments playing up different, thinking that it was like creating a Frankenstein, which then went out of control. It was to play both up to then weaken different groups, but it ended up eating the health. I mean, it ended up resulting in unending crisis. But how does it, going to the question, how does it affect it? I say it's the other way round, because looking at health in a holistic sense here, the question of unsafe working conditions, inadequate remuneration, and also, because this is important when we look at occupational health in a systemic sense, the need for safe and effective staffing for health. But lack of it, you know, it puts psychosocial as well as physical risk on a broad gamut of workers in the sector. Now in Nigeria, the absence of this feeds anger from below. But most importantly, and this is what I think we should focus on when we're, and this is like when I'm talking of how do we bring health workers in. Most of the conflicts we have had in the health sector in Nigeria have not been between cadres of health professionals. Each has been with government. And on almost all of these, the disputes have been what in industrial relations we describe as dispute of right, not dispute of interest. That is to say, they are not reopening new issues.
Yes. Interesting. I'm afraid we'll be kicked out soon by from our from our organizer. There's a couple of questions for WHO that I'll ask. One is, does WHO care about the private sector provision of private healthcare facilities? Yes, of course we care about any kind of healthcare facilities, So our call for action and for development of programs is both for the private sector and for the public sector. We want to have them on equal footage. And then there was another little question to WHO about templates for reporting of occupational incidents and diseases in the health sector. We do have certain templates for reporting of exposures, for example, for COVID-19, bloodborne pathogens, and then for occupational accidents, the general templates for reporting in the country supply. But all occupational infections, they require specific epidemiological investigation, like any other occupational diseases. And with this, I really would like to thank you very much for taking the time to participate in this session, and for the very interesting insights that we heard from you, from your experience, from your perspectives, and opening the doors. And I hope other countries in West Africa and beyond would be excited after that session to develop their own national and facility programs for occupational health and safety for health workers. Thank you very much, and thanks again for IOSH for hosting this webinar.